My diagnosis was partially functioning, massively dilated right kidney. This thing was 22 by 18 centimeters. It was a massive cyst. It was pushing all my guts over the side, and it was a completely asymptomatic finding. I was clueless about this beast in my abdomen, which I'd probably had from childhood. Luckily, my other kidney was normal and functioning well, and was a little bit hypertrophied, that is a little bit bigger than normal. So it's been doing double duty. And as we know, you can live with one normal kidney. You know, after I got over the shock of having this beast inside me and deciding I needed out, I called some of my surgical friends. I called some of the nephrologists, who are the people who medically manage kidney disease, who work with Scott the most. I called some of the surgeons around the medical center. And to be honest, I didn't need to make very many calls. I'd sort of made up my decision right away. But there was one particular surgeon who's actually a partner of Scott's, and I was operating on him. He was in the office. I was draining his knee, or we were in the operating room. I can't even remember exactly where. And when he found out about my situation, he stopped and froze, and he said, "Byron, this is not optional. There's only one person that I'm going to permit you to go to. I don't care if it's inconvenient. I don't care if you have a relationship with another surgeon. This is the guy." And I'm very grateful. In fact, I threw a dinner party for him to thank him, and included Scott afterwards. I was so happy with the recommendation. The urologist that I had seen before Scott is a great guy, and they took good care of me, and their standard recommendation was for what's called a HAN, H-A-N, which stands for hand-assisted nephrectomy, which is done through a transperitoneal approach. That means they open up the abdominal cavity, and they make an incision big enough to put your hand or fist in and assist with the surgery. That's a very standard procedure, especially for something this big and difficult. Scott's approach was entirely laparoscopic, that is, through small incisions, and retroperitoneal means not entering the cavity, the abdominal cavity. This was huge for me because being a busy surgeon, I wanted to go back to work as soon as possible. And indeed, his efforts were helpful in that regard. I had my nephrectomy on a Thursday, and I spent one night in the hospital and went home the next day, and was sore for a bit, but much less than I would have if they had opened me up. And I'm very proud to tell you that on the 2-week anniversary of my nephrectomy, that's 14 days from surgery, I did 5 total joint replacements. I'm not going to tell you that I was happy that day. Well, I was overjoyed to be working, but it was sore. But just as an example of how quickly you can get better. Obviously, everyone's problems are different. Mine was technically very challenging for him because he had to peel this mass off my inferior vena cava, which is the main vein leading to my heart, and it was at very high risk of bleeding, and a lot of bad things could happen. And the way my luck was going at that point, I fully expected to wake up with a big bleed in the ICU and sick as can be, and I just did fine. And I will be forever grateful to Dr. Miller for his expertise. This is a surgery that very few doctors are skilled at doing. You need to go to someone who is skilled at this procedure. I deal with lots of surgeons all the time. There's some good ones, there's some bad ones. And Scott is an unusually gifted surgeon. He has clinical judgment of when to do things. He has magic hands, and I can't recommend him highly enough.